Welcome back to Mouth Care Without a Battle. In Module 1, we talked about why mouth care is health care and not grooming, and how providing good mouth care can improve quality of life and reduce pneumonia, hospitalization, and even death. You learn the basics of providing good mouth care even in special situations. We realize that providing good mouth care isn't always easy. We know there are situations when people refuse care.
Is it okay if I do mouth care on you today?
No.
No?
No.
I got to brush your teeth. You gonna let me brush your teeth?
No.
Why?
I'm tired, honey. I'm tired.
Won't open their mouth.
Open your mouth. Open your mouth, Joe, so I can see your teeth. Go ahead, open it. Go ahead, open it. Open it for me.
Grab you or the toothbrush. Try to push you away.
Open wide. Almost finished.
Go with it out.
Bite or suck on the toothbrush.
Relax, sweetie.
Or resist denture care.
I'm gonna take them out your mouth, okay? Just hold my hand. That's all. So all.
In this module, we'll focus on the special challenges of providing mouth care to people whose behavior makes care more challenging, and we'll teach you to be an effective problem solver when faced with situations. The key is understanding that challenges are actually a form of communication. After completing this module, you can apply for 1 hour of continuing education credit. Because Alzheimer's disease and related dementias are the most common cause of behavioral challenges, we'll focus on them in this module, but the skills you'll learn will be helpful in almost all caregiving situations. In the past, it was common to think of only 2 options when someone with dementia refused, resisted, or fought care. Either force the care on them, or more commonly, not do it at all. But it doesn't have to be that way, and it shouldn't be.
And I was noticing the different changes about him as I would come into the room. He was getting more familiar with me. And that particular day, I went into my car and pulled out his toothbrush. And I wanted to demonstrate for him to open. He reached for his toothbrush and he began to brush himself. And that was just overwhelming. So I enjoyed that. And I could tell the difference that he enjoyed it.
And when they see me, they're like, oh, yeah, could you come and, brush my teeth?
I think it's very important, this job, brushing the teeth, the oral hygiene. They really need it.
How do they do it? Well, they were trained in the techniques we taught in Module 1. They had good support from their supervisors, and they used the dementia care approaches taught in this module. To get started, let's review a few basics about dementia. As you know, dementia is a brain disease that causes a person to gradually lose the ability to remember, do simple tasks, understand, and communicate. Even tasks like toothbrushing become difficult. Alzheimer's disease is the most common kind of dementia. Over as long as 8 years or more, dementia progresses through 3 stages: early, middle, and late. Understanding these 3 stages is important because depending on the stage a person is in, you'll want to adjust your approach to care. If the person you're caring for has early dementia, they'll usually be able to communicate well, express their needs, and follow simple directions. For them, you can help by providing simple, single-step instructions, such as put the paste on the brush, and then brush your front teeth, and then rinse your mouth. Here's how one nurse's aide helped a man with early dementia brush his teeth.
Wiggle, wiggle down. Wiggle, wiggle. Not wiggling. Like this. Watch. Go ahead. Wiggle, wiggle down. Wiggle, wiggle. Here, I'll show you first. Ready? Wiggle, wiggle. Down. Wiggle, wiggle down. Wiggle, wiggle down. Wiggle, wiggle down. All right, go ahead.
I would do the best before they get down in the water.
Wiggle, wiggle down. Tap. Tap, tap, tap.
Memory problems are one of the first signs of dementia. It's not uncommon for someone with early dementia to think she's already brushed her teeth even if she hasn't.
You done already done my teeth.
No, let's floss and get some of that food out. Okay?
Another aspect of early dementia for some people is getting easily upset or anxious, or having trouble adjusting to new routines. For this reason, it can sometimes help to do mouth care at the same time every day with the same person providing care. As people with dementia progress to the middle stage, they have more difficulty understanding you and expressing themselves. They're often so confused that they don't understand what you're doing or why you're doing it, and so they get easily agitated. Still, they can usually use simple words like yes and no to express themselves, and sometimes understand hand gestures. At this stage, you may encounter hitting, spitting, grabbing, biting, or yelling. Fortunately, many people with mid-stage dementia become more agreeable if they can participate in their own care. Of course, if the person does her own care, you'll probably need to tell her exactly what to do, step by step, in a more detailed way than you did for someone early in the disease. You may also need to provide hands-on guidance. Let's see how one nurse aide was able to get the job done.
You're going to feel so much better, Millie. Give it to you? All right. All right, brush your teeth.
Good.
The caregiver did several good things here. She let the woman start brushing when she asked for the toothbrush, and then she guided her hand to make sure the teeth were being cleaned. In the late stage of dementia, people need most of their care done for them, including mouth care. They can't tell you their needs with words, and they generally can't follow directions, but you can learn how they feel by watching their body language and listening to the sounds they make. At this stage, it may be hard to encourage the person to open her mouth and to keep it open. As you provide care, be sure to tell her what you're doing. Use touch to help her understand, and offer lots of reassurance and encouragement. Let's take a look at care for someone in the late stage of dementia who can't talk or provide any self-care.
Betty?
Who's Betty?
Betty? Hey, Betty? Betty? Betty?
I'll give you a smile. Ask her about it.
Can you smile for me? Betty?
One important thing to realize about dementia is that what works for one person may not work for another, and that what works today may not work tomorrow. So you'll have to individualize your care from person to person and sometimes from day to day. You'll need to be flexible and patient and to think like a detective to figure out the person's needs and how you can meet them. Now that we know a little about dementia as related to mouth care, let's talk about some specifics. First and foremost is making mouth care part of the relationship between you and the person you're caring for. People don't always realize that mouth care can be an opportunity to build a positive relationship, but it can be, if you focus on the person as an individual rather than on a mouth care as a task. Here's a video that shows how important the relationship between the caregiver and the person receiving care can be.
I am so thankful, honey. We're going to have to go bake us some pies. What you think? You going to teach me how to make a chocolate pie?
No, I just looked in there for he was going to put the pie in. I said, I think you better wait till.
Oh.
I didn't really know how to put the pie in there.
Oh.
As you saw, the caregiver was paying attention to the person, not the task, and by so doing, made the experience more pleasant for both of them. This woman might have been anxious about receiving care, but the caregiver's friendly conversation put her at ease. One key principle of care for people with dementia is that when a challenging behavior occurs, it's happening for a reason. It's the person's way of telling you that he or she needs something, because the disease has robbed the ability to communicate with words. Your job is to use what you know about the person to figure out what need is being expressed and how you can meet it. Another key principle of care for people with dementia is to support them to do things for themselves as much as they're able. Many people with dementia can provide their own mouth care, especially in early dementia. To make them successful, you'll need to help figure out what kind of help they need. They may need you to set up their supplies. They might have trouble getting to the sink and may do better with a bedside table. They may need you to give step-by-step instructions, especially to do a thorough job cleaning their mouth. So once the setup is done, watch the person brush. Do they jiggle and sweep, or do they brush side to side? Do they brush all of their teeth? Here's how one care provider watched first and then offered guidance when she saw it was needed.
Let's do it on the other side. On the other side. Get that too.
Once you've helped the person do as much as she can, check to make sure she's done a good job. It usually works well to say something like, "Let me see if there's anything else that needs to be done," or, "How about if I try to get those hard-to-reach places?"
Let me try to get some on it for you, all right? Okay.
This touch-up care often includes brushing the insides of the teeth and using the interdental brush to clean between the teeth. Now that we've gone through the stages of dementia and a few basic principles of mouth care in dementia, we're ready to talk about how to address common behavioral challenges by which people with dementia are communicating to us. That means, as you might guess, beginning at the beginning, before you walk into the room. Remember, you're focusing on the relationship, which means it's all about connecting with the person and doing so with respect. Knock before you enter the room. Approach from the front so she knows you're there. Say hello and remind her who you are. Move and speak slowly since it may take time for her to process what's happening and what you're saying. Make eye contact so she knows you're talking to her. Perhaps make small talk, such as by commenting if she looks especially nice that day. Then, explain why you're there and ask permission to get started. If you do these things to make a connection, you'll find it easier to do something as personal as mouth care. Watch this next video.
Good morning, ladies. Hello, my name is Wanda. And I'm here to clean your dentures for you this morning, okay? Is that okay with you? All right.
Did you see how Wanda knocked, moved slowly toward the woman, made eye contact, then said hello, introduced herself, and asked permission to get started? These are simple, respectful activities, and they're central to good care. Challenges can and do arise, however. As we look at specific cases, we'll ask you to think about how you might handle each situation. Keep in mind that there are often as many right answers, not just one. That's why we'll focus more on problem solving rather than on finding one right solution. Here's the first situation: refusing care. It may happen right as you begin, when you tell the person that it's time to clean their teeth and they say no, or shake their head, or refuse through other behaviors. What you do depends on the reason the person is refusing. We don't want to force mouth care on someone, but we do want to provide good care. So try to figure out the reason the person is refusing. Let's look at a video of one such situation and think about what the person is expressing and what you might do next.
I'm here to do your mouth care. Can I go ahead and put your medicine on your teeth?
No, look.
It's going to make you feel better so you can enjoy your breakfast.
Man, just going back off and finish and he's coming outside.
Miss Boyd, it'll take about 5 minutes, sweetheart.
I know, I ain't doing things that I can't eat.
I want to give it to you before you eat. Your mouth will feel better.
I know, I ain't no good now. I'm feeling
Miss Boyd, it'll only take 5 minutes, sweetheart.
I ain't no food with it. I told you to go and make it.
Miss Boyd,
I ain't no good.
just listen to me, okay?
I ain't no good.
Miss Boyd?
Ain't good.
Miss Boyd?
Shut up. I ain't going to lay there.
Yes, ma'am. I'll come back, okay?
Uh-huh.
I'll come back. I have to come back and do your mouth care. Yes, the dentist seen you last week, and he said we was doing such a good job. He wanted to see the work continue. No, he gave you a real good report. You want me to come back? Or you want to go ahead and get it over with now? Okay, I'm going to come back. I'm going to have to come back, okay? No, ma'am, I have to come back today. Just relax. I'll be back.
This woman can express her needs and probably has middle stage dementia. She's upset and tells the aide that she wants to eat first. She even tells the care provider to shut up. The aide does well in staying calm and complimenting her on the good report she got from the dentist the week before. When it becomes clear that she won't be able to do mouth care at this particular time, the aide tells the woman that she'll be back later. This is a perfectly appropriate solution. Often, a person just needs time to be in a more receptive mood. For the woman in the video we just saw, there may be a specific time that works best. Some people like mouth care as part of getting up in the morning, or as part of getting ready for bed, or both. Some prefer care before eating, and some like it afterwards. The most important thing is for you to adjust your schedule to accommodate the needs and preferences of the people you care for. Here's what one care aide had to say about her experience finding the best times to provide care.
I come in around 5:45 to the Alzheimer's unit, and I start in a 4-bedroom dorm, and I get all the toothbrush ready, and I put a towel over them and say, you can stay in bed nice and warm. I'm just going to brush gently. And I can brush and they're still snoring. I can brush and floss because the mouths are kind of already opened. So it's the best time to get them.
Now let's look at another person who's refusing care. As you watch the clip, think about why she might be refusing care. Then think about what this person needs and what you would do.
I'm sorry, honey. Well, I got something that's going to make you feel a little bit better. We're going to brush them teeth, all right? And you can help me if you want to, all right? I'm going to get set up here, all right?
You'll get what?
I'm going to get set up. I'm going to set up your toothbrush and stuff.
This woman was hard of hearing and didn't actually have dementia. The real issue was that she didn't understand that the aide wanted her to brush her teeth. So for her, the solution was to speak clearly and show her the toothbrush while explaining the intent. Care became simple once the care providers figured out what needed to be done, but until then, her mouth care had been a challenge. Of course, sometimes people can hear you quite well, but don't understand. In that case, you should position yourself at eye level and speak slowly and clearly. You might try explaining the situation using different words, such as saying clean instead of brush, and using gestures to help the person understand, such as modeling that you're opening your mouth and brushing your own teeth. Another reason people with dementia might refuse care is fear. Fear that they won't be in control of what's happening in their mouth, or fear that what you're doing might hurt. When this happens, it can help to give a reason for providing mouth care. You might say something like, "Your mouth will feel better," or "Let me get that food out from between your teeth so you're more comfortable." It's also helpful to provide reassurance by saying something like, "I'll be very careful not to hurt you," or "If anything bothers you, tell me right away and I'll stop." If the person has advanced dementia, you might provide something comforting to hold, such as a blanket or stuffed animal. Here's an example of a care provider making someone with mid-stage dementia feel comfortable before getting started. Pay attention to how patient the nurse aide is. This is important because, like many people with mid-stage dementia, the woman's dementia causes her to take a very long time to understand, process, and respond to what she hears.
Thing to get that meat out your teeth, okay?
No. No.
I'm gonna give you the toothbrush to let you start brushing it so you get some of that food out your teeth. You got something between your teeth.
I want you to wait till Bishop come and fix things.
Yeah, he gonna come. He on his way. You finished with the cut? Are you finished spitting this stuff out? All right. Yeah, brush some of that stuff out your teeth. You want me to do it or you gonna do it? You want me to do it or you gonna do it? You want to do it or you want me to do it?
Okay, let me think.
You got it or you want me to do it?
Wait a minute.
Okay, okay. I'm helping you get some of that stuff out your mouth.
Another reason people refuse mouth care is simply because of bad timing. Perhaps the person is tired. You might have patience for this if you think about the mornings when you're not ready to get up. Would you want someone putting a toothbrush in your mouth? If you suspect that's the reason someone is refusing, come back later. The bottom line is that by taking the time to consider why someone is refusing, you can make mouth care a pleasant experience for both yourself and the person you're helping. You should realize that refusals are going to be more likely at first, mostly because people may not be used to having mouth care done, either at all, or by you, or in the way you're doing it. It may even hurt at first, as shown on this video.
Miss Lily? You okay, sweetie? You jumping? You okay?
It hurt.
It hurts? Okay, I'm gonna go easy, okay? I'm sorry.
If so, you may want to not provide care every day in the beginning, but you will want to do it regularly. In a short time, you'll be able to do it daily, not only because it's important for health, but also because getting into a routine makes mouth care more comfortable and easy to do on a regular basis. One way to phase in mouth care is to brush just the front of the teeth one day and the back of the teeth the next. Then, once the person has become comfortable with brushing, you can start to use the interdental brush between the teeth, since that's often the most difficult task. If the person is agreeable and cooperative at first, but becomes upset once you start providing care, do what you can, but don't use force. For example, if you can get the toothbrush into the mouth, brush the front of the teeth. If the person opens their mouth wider, brush the back of the teeth right away, since the back is harder to reach. Rest assured that if you keep providing mouth care every day with a personalized approach, the people you care for will begin to trust both you and the process of mouth care, and after a few days or weeks, it'll become routine.
The most important part of was getting the residents to trust me is doing the mouth care. One particular resident was, at first, she went from a no to a